Stripping membranes or membrane sweeping, what is it? What are the risks involved? What should you expect from it? And is it going to kick you into labor? As someone who's had a lot of membrane sweeps myself and has seen thousands of patients who have had them in the office, I'm going to tell you the risks and the benefits and what you can expect if you're wanting a membrane sweep or your provider is offering one. That's right, I said offering one. Some providers do these unwarranted, although I'm finding that less and less. I think knowing what you want in a perfect world is awesome. I think creating a birth plan helps share your wishes and dreams with not only yourself, but also your care team. I'm going to put the link for my free birth plan series down below. Okay, first off, what the heck is a membrane sweep or stripping your membranes? Valid question, because we don't just want to strip things, right? Okay, so your uterus is obviously inside your pelvis, and they go inside with a gloved finger. They're going to go into the bottom of your uterus, which is called your cervix. And I want you to think of a water balloon filling this up. That would be your amniotic sac where the baby lives inside. They're going to take that gloved finger and they're going to go between the cervix and that bag of fluid. And they're going to strip between those two. And the idea is that stirs up hormones and stuff to hopefully get you started into labor. They're just kind of agitating it for you. Now, a lot of you are like, I have no idea what you're talking about. If you are a plumber or you've used any plumbing things, you got to think about getting between like the O-ring and the tube that the O-ring is sealing off. Same idea. You're just kind of going between those things to, get rid of the seal between those two things. That's all that they're doing. Now, can that be painful? Honestly, it really depends person to person. I find that if you are already not a fan of vaginal exams, you really are not going to like them stripping your membranes. And I think that's something important to know as you're thinking about this. If you really hate that and it's wildly uncomfortable for you, it's going to be up to you, but you might not find that that's worth it to you. How long does a membrane sweep last? I would say about a minute. Now, as a labor and delivery nurse, I am not, at liberty to do a membrane sweep. And so I've actually never done it, but I've seen doctors do it and I've seen lots of patients have it done. And I would say about 60 seconds. So it's longer than a regular vaginal exam, but it's not like wildly long. And I will say I see some doctors who really get in there and sweep up those membranes. And I see some that I'm like, when are you going to start? And they're done. So it kind of varies practitioner to practitioner. And the weird thing about this one is you don't really want them to be gentle per se. Like if you want them to strip your membranes, you want them to get in there and do the job, not gently do the job, because a lot of this is that mechanical force of stripping between the bag of fluids and your uterus. And that is what is going to sweep up those hormones. Now, I think knowing the pros and cons is something that you're going to want to know before accepting a membrane sweep. That is something your provider should be offering you. But let's talk a little bit about the risks. As you can imagine, as you stick your finger there between the bag of fluid and your uterus, there is a chance of them rupturing the bag of fluid. Now, I've got to say, I have not seen this too much because it's not like they're poking the bag with their fingernail. They're really just gently kind of stripping away that adhesion between the two of them. But it can be a risk. There's also always the risk when you put something inside the birth canal that there can be an increased risk of infection in this area. And especially because they're being less gentle and they're doing that type of thing, there's probably an even increased risk than just a regular vaginal exam for infection in your uterus and possibly the baby, which is called chorioamnitis. What brought you to this video? I'm interested to know if you're thinking about getting your membrane stripped or if you just saw it and you were like, what the heck is that? Tell us down in the comments. Now, what should you expect after a membrane sweep? I've got to say that most people contract quite a lot. Again, getting their hopes up. But for most people, I see those contractions die down and it doesn't really do anything. But for some people, including me on my second baby, those contractions keep going and it gets you into labor. I personally think, we're going to get to the studies later, but I think that if you were going to go into labor in the next day or so, a membrane sweep might bump you there just a little bit early. However, I do not think that a membrane sweep is really going to put you into labor if labor is not in your near future anyway. You might also notice some bleeding, and your provider should go over which too much bleeding and what to expect after the exam. Some people have changes in discharge. You might lose your mucus plug if you haven't already lost it. And again, the cramping or contractions you're going to feel right after it's done. And as a pro tip, make sure that you're well hydrated. A lot of people have contractions because they're dehydrated, and those contractions are not going anywhere. That's not putting you into labor. It's just needless pain. So make sure that you're hydrated so that you're not having the needless irritability contractions. Now, what do studies show about the chances of this putting you into labor? And I'm here to say that most people would not be like, yeah, do an extended vaginal exam unless they saw a pro of hopefully the baby coming out sooner rather than later. There is a Cochrane meta-analysis that showed that there was some correlation of a membrane sweep putting you into labor and less likely of needing an induction, although the statistics are pretty mild on that one. It is definitely not a sure thing, unlike an actual induction of labor at the hospital where we use medications and things like a Foley bulb to really get your labor going, as those are proven techniques to start labor. And as a pro tip, after you have this done, you want to make sure that you're still doing your kick counts because you want to make sure that baby is still thriving in the womb. If you have any questions about how to do kick counts, I have a whole cheat sheet. I'll put the link down below. Now, a lot of people will say, how soon should it put me into labor? And the Cochrane meta-analysis didn't give any timeline. If you look online, a lot of people say within 48 hours. I don't know. The thing is, a lot of times you're getting your membrane stripped right at the end of pregnancy. So would you have gone into labor anyway? It's hard to say. But again, the studies didn't really show me any specific timeline as to when labor should start after you get your membrane stripped. Now, you might be wondering, how dilated do you need to be to have your membrane stripped? And that's a good question because if your cervix is actually closed, we can't get in there with our finger to strip the membrane. And so it does have to be open, usually at least 1 centimeter, so that they can get a finger in there and do the thing that they need to do. I know a lot of people are looking for a membrane sweep, but their cervix is closed and we just can't do it at that point. Now, a lot of you might be wondering, when is my provider going to offer me this? I am done being pregnant. It's a great question to have with your provider, but they will not be doing this until at least 37 weeks of pregnancy. We do not want to do anything to induce labor prior to that time because baby would be considered preterm at that point. We've just seen better outcomes when babies are born after 37 weeks. But if you're after 37 weeks and you have an appointment and they haven't offered it, you can ask them, hey, would you mind stripping my membranes? And again, at that point in time, you should have a discussion about the risks and the benefits. I have seen people online who the provider said, no, I will not strip your membranes. Maybe it's just not something that they do. Again, there are risks to it. Maybe they've broken somebody's water and had a poor outcome. So maybe they aren't going to strip your membranes. And because the evidence doesn't show that it's really an important part of your care, that's up to your provider. A lot of providers will offer a cervical exam, at those 37 plus week appointments. And while they're in there, you can say, hey, will you strip my membranes? Or they may ask. Again, a provider should be asking you if you want your membrane stripped. They should not be just doing it on their own. However, a lot of people think just a regular vaginal exam is them stripping your membranes because they find those to be very painful. If you're interested in ways to make vaginal exams less painful, I actually have a whole video of it. I'm going to put the link down below. And again, it's always up to you if you want to have the membrane stripped or not. The choice is yours. And if you're saying, Hillary, this seems like a lot of decisions as I get closer to my due date, I'm here to say, yes, there are a lot of decisions that you're going to have to make. In the online prenatal class for couples, we talk a lot about decisions you're going to have to make and how to make them based off of the risks and the evidence that your provider gives you. I'm going to put the link for that class down below. And if you're thinking, Hillary, I wish my partner would watch videos like this to get prepared with me, I am right there with you. I think it's so important that partners get prepared so that they can be a teammate rather than just a cheerleader over in the corner scrolling on TikTok. Some of you might be wondering, I got my membranes stripped last week. Can I get them stripped again at this week's appointment? Most often you can. Again, talk with your provider to see what's right for you. Now, here's the big question. Should you be okay with getting your membranes stripped, or should you ask to have them stripped? Let me read directly from the study. 3 studies providing data for 675 women reported that women indicated favorably on their experience of membrane sweeping, with one study reporting 88% of the women questioned in the postnatal period would choose membrane sweeping in the next pregnancy. So that shows us that women felt like it was okay and they would recommend other people do it as well, in case that helps you out. Like I said before, if you absolutely hate a vaginal exam, you are really going to hate a membrane sweep. So that might just not be worth it for you, on the off chance it might put you into labor. But if you don't mind a vaginal exam and you're absolutely done being pregnant, I think it's a-okay to ask your provider to do it, or consent if they ask if you want it. Again, this is all choices that you need to make as you head into labor. If you're thinking these are a lot of decisions, I actually have a whole video on making choices in labor that I'm going to link to right here. I think it's going to be really helpful as you head into the hospital. Thanks for joining us here on The Pregnancy Nurse, where we get you prepared, not scared, for your upcoming hospital birth.